Thank you very much. Thanks for the nice welcome. I appreciate that. And right, I am looking forward to some soft water out there instead of the hard water, and get out there and do some fishing. yeah, it's ugly out there. But thanks for joining us today. I love just getting together with groups of people 50 plus and talking about these issues that you're facing with financial security, caring for your family, healthcare issues, and so I just appreciate the chance to talk with you for an hour today. And I hope it'll be a real interactive discussion. I don't intend to lecture you, and as I was saying before, really we can learn from each other, especially with the issue of caregiving. The way it works is that you don't have to know about it, you don't have to do anything about it until you're in that situation, and maybe you have to take care of a parent, or maybe you have to take care of a spouse. And so learning from each other and learning from those type of experiences really tends to help people. So just a few words about AARP. We have a state office in St. Paul, and there's a state office in all 50 states, but most of my coworkers work in Washington, D.C. Our mission is to enhance the quality of life for us all as we age, and really help people turn their dreams into real possibilities, especially in retirement. And so if we think about quality of life, really, what it often starts with is some financial security, so you have some choice in retirement about how to spend your time and your money, and then it comes to health care, and it comes for caring for your family. So those are the kind of cornerstones of quality of life for people in retirement, and we're focusing on caregiving today. AARP is a nonprofit association. We have 37 million members across the nation, about 650,000 in Minnesota, so a lot of people. And we don't give we're involved in politics. We're nonpartisan, but we're involved in politics, but we don't give campaign contributions or, we don't give money to politicians in order to sway their vote. What we'd have is the power of hundreds of thousands, millions of people who vote, right? Older folks are the ones who vote more than the younger folks, so it's a powerful voice that we have. So we'll get on with today's agenda, and as you can see, you each have a workbook that we'll go through, and the workbook is actually available online if you go to AARP/caregiving, or even search online AARP Prepare to Care, and it's pretty easy to find by searching online. But you have hard copies here in the room today, and we'll go through the book together. And these are the sections that we'll cover. First, I think the biggest hurdle that people face, even that I'm starting to think about now, is my parents are retired, they're getting older, someday they're going to need some more help. So how do I start that conversation with them? And judging from the morning group that we spoke with, that was a big challenge for a lot of people. And they haven't necessarily worked through it. They haven't really solved that challenge yet. So that can be a big challenge. Suddenly you're in the role of being the parent, right? When your folks have been in that more powerful role for all of your life. So it's an interesting and difficult role reversal for people. We'll talk about how to think of yourself as a leader in a caregiving team rather than the one who has to do all of the work and handle all of the details. So we have some good examples of that, I think. And in the last section of your workbook is an actual planning document that we'll discuss. So we think we've done a pretty good job of identifying a broad range of details that need to be considered when someone needs a caregiver. And we'll talk about resources that are available not on a national level, but not just that. There are some local resources here that are really good, helping you navigate the healthcare system, and helping care for parents or a spouse or maybe even a friend that needs some help. And finally, the importance of caring for yourself. The concept being that a person can't run 100 miles an hour 24 hours a day and expect to be able to keep that up over a long term and be able to do the best they can for their loved one. Because this is about the love that we have for our families, but also helping to protect some finances as well, right? So those are the motivations. And planning ahead is, we hear so many stories at AARP about people who get a phone call in the middle of the night and their mother has fallen or perhaps had another health emergency, and now it's midnight and they need to figure out what nursing home to bring their parent to, and they hadn't considered it before. So what we hope today is that just starting to think about it in advance, having a plan in advance can prevent people from having that midnight phone call crisis and not knowing where to go or what to do. So let's start with introductions. It's a small group, so I think we can just go around the room and perhaps start with Maria. And just who are you and where are you from and what do you hope to get out of today? That would be great. Yeah. Well, let's keep the conversation going. When it comes to starting that conversation, and this morning there were some pretty powerful stories about how challenging that was for people. Any of you have that experience and be willing to share about how did you have that first conversation or open the door for yourself? That's interesting, Doug. I've heard that from other people too, that when a person has a really difficult time working with their own parents in a health emergency, then they're more ready to talk to their own kids about here are my wishes, here's the way I would like my aging to progress. So, yeah. Anyone else? Well, it can be really challenging. I mean, that's the bottom line, is they've been in the role of a parent for your whole life, and now it's time that they need often you to take a leadership role. And so it's actually page 5 in your booklet. There are some tips on starting that conversation. I think an important point is about respecting a parent's wishes, of course, and just like Uncle Don, always been in charge of his own life, that's important to him. I'm not saying it's necessarily the right way to approach aging, that a person wouldn't want to accept help, but can you picture a situation in which the opposite? I mean, imagine what that might be like for you if your family or others were making decisions about how you were cared for. So that's what kind of drives that home for me. And by having advanced conversations, there's an opportunity to negotiate and discuss those wishes through the lens of what's actually financially possible, what's actually what the family's actually capable of supporting. And you were going to say? Yeah, and so vice versa, Uncle Don, put yourself in your shoes, So I'm certainly not saying that it's a healthy relationship, a healthy way to approach aging just to not accept help. That's not at all what I'm saying. I just wanted to start the conversation by talking about respecting a person's wishes. And I guess it's a tip, but one kind of tactic I'm learning about for myself when it comes to having difficult conversations, maybe it's just a personal friend relationship or a member of my family or a coworker. If I find myself kind of in my head thinking about how am I going to approach this situation, I've had some success just kind of saying it out loud. So in this case, maybe, Uncle Don, I'm having a really hard time figuring out how to have this conversation with you. I'm really concerned that as you age, if you haven't had a will put together, if you haven't had taken other steps for your estate and your own health care, that it's going to be really difficult for me and you won't necessarily get the level of care that you want. So I think you see what I'm saying, that just by saying it out loud and saying how difficult it is potentially for you to help Uncle Don with aging, that you're asking him to work with you on those necessary steps. And I think this resource, this booklet, this resource can help with that too. Not that everyone thinks that AARP is the authority, but this booklet could be a tool. Hey, I got this book from AARP, and they suggest that we have a conversation about all of these different considerations we should make for aging. So finances are often the limiting factor on a person's goals. So starting with how does a person want to age? Do they want to stay in their own home? Do they want to be in assisted living? That's important to start with those goals, but then reviewing the finances to figure out what is actually possible. Is it possible to live in the nicest assisted living facility in town? Not for everyone, obviously. So we recommend starting with the goals and then getting to the finances and figuring out where a compromise might need to be made. Safety is often kind of a major hurdle to cross over, and can also act as an inroad. We were talking this morning with a family who finally had to get the car keys, right? It's time to stop driving. And at first that was a big challenge, and they had a series of conversations and were finally able to focus on safety. And then also, what are some alternatives for mom to be driving herself around town? There are nonprofit associations or organizations that can provide some transportation services. How can the family help out? How can maybe neighbors help out with the travel? So safety can be a good place to start. Any other experiences with starting that difficult conversation? Maybe even think about whether it was regarding aging or not, what was the last difficult conversation that you had to address with a friend or a family member about something else? I wanted to, back on that topic, I wanted to bring up an example of this movie called Gen Silent, like Generation Silent, Gen Silent. It's actually a movie about LGBT people as they age and how they tend to be isolated or are more at risk for isolation, just because the nature of the lifestyle has often isolated people from their families and their support structure. And the part of the movie is that this one woman is trying to reconnect with her family after having been isolated. And for people struggling to start the conversation with a loved one about this type of caregiving situation, I thought the movie was very inspiring, because it was this man who had been estranged from his family for many years, and he was picking up the phone and saying, I'm sick, I need your help, and I need my family to help care for me. So if he could make that phone call, then I think it's inspirational to how I could talk with my parents, or how you could talk with your uncle and have that conversation. So I'd recommend it. Gen Silent. I think asking for help is un-Minnesotan. Am I right? It's un-Minnesotan. And I mean, even I think of myself just as a young male and wanting to do it all myself. And so asking for help from a team of people or my network is not always my first reaction. I can tell you from meeting so many caregivers, the struggles that they go through, the challenges that they face has changed my mind about what I'll be doing when it comes to taking care of my parents or someone else who I need to help. So in that same movie, actually, the man who didn't have a lot of family to help care for him worked with a social worker, and they were able to organize neighbors, coworkers, some family, some friends, and form a team of caregivers, and they sort of divvied up the tasks. There was even a time in his life where he needed 24-hour support, couldn't do daily living tasks without support. And they were able to organize this group of people to cover that 24-hour support. So there's a level of just being okay I mean, when's the last time you asked someone for a favor? Can you think of one? This morning? Okay. So that's good. That's good. What was it? Oh, very nice. Very nice. Do you think you'd ask to help take care of a family member if you needed something? Like your mom, if your mom needed a ride to the grocery store or something? Does that?
Siblings for that.
Yeah.
That's a different group.
Sure. Sure. Yeah. Yeah, that makes sense. I just wanted to get us to think, what would it take to view ourselves not as necessarily alone in caregiving, So you could knock on the neighbor's door. I don't know the last time I knocked on my neighbor's door. I don't know that experience, especially as Minnesotans, right? So anyone how is it working with siblings and the duties of taking care of parents? Anyone have experience with that? Yeah? Is it amicable and works like clockwork? Pretty well? Mm-hmm. Mm-hmm. That's good. It wasn't the same this morning. One family, they were really upset with the way that the siblings were not participating, and another family had people spread out around the country. So we spent a lot of time kind of brainstorming about if one of the siblings lives in Texas, what could they do to help? They're not going to be doing the grocery store trips, but could the bills be addressed to them and they handle the bills? Maybe. Could they be the ones that do some online research? Who knows? So it goes back to that concept of viewing as a primary caregiver, not necessarily the doer of all tasks, but how could you recruit someone else to help? How could you delegate some tasks out to folks that can help and spend some time as a leader rather than just as a doer? Yeah, and then I guess in terms of maintenance, what else could you do to recognize people for helping you? Are you going to have them over for dinner once a month or something like that? I think it's somewhat of a different way of approaching the work of caregiving than just, all right, who's going to bring mom to the next doctor's appointment, right? How can you really try to build a system that works? All right, let's talk about making a plan, and it's actually on page 10 of your book. And these type of considerations are what we need to make. Like I was saying before, what are the goals? How do we understand what the goals are? Is the goal to help them stay in their own home? If that's the goal, then the activities are going to be a lot different than if they were going to assisted living or some other type of nursing home or such. And on page 23 of the book is that sort of checklist guide that we can follow to make sure we're covering all bases. So the finances often rise to the top and making sure the bills get paid. I was talking with one person who that's where they kind of found out that there was a crisis and there was some dementia happening, that suddenly some of the bill was being missed 1 month, or I never saw the bill in the mail and it went unpaid. So their first step was to figure out who's going to be paying the bills, right? And if you think about all the things that you need to do just to maintain your own day-to-day life, I mean, obviously, for caring for another person, those are all the considerations that need to be made for them as well. So the good news about a lot of these issues is that there's help for them. So through social services, through the healthcare system, through nonprofit organizations, often people can get help with these type of things, like home maintenance. Has anyone ever heard of a service that does fall cleanup, leaf raking for seniors, right? There's some help with that. Snow shoveling, an issue. It's going to be an issue in about an hour for all of us. Snow shoveling? Oh. I can't think of it off the top of my head, but I can tell you the senior linkage line. Who has heard of the senior linkage line? You've heard of the, okay.
There are Girl Scout troops and stuff that specifically do that for retired folks.
Sure, sure. And churches, sure, yep. So what have you used the senior linkage line for? Can you remember what you called them for?
I found out, I met him at the Roseville Home and Garden Show. And found out about learn how to use your computer class.
Oh, sure, sure.
That's as far as that went, but I learned about it. So
Yeah, yeah. Yeah, well, the phone number's on one of the next slides here. Yeah, you can see the phone number there. But it's run by the state of Minnesota, and it's designed to be a one-stop shop that people can call and get resources and get connected to organizations, to people, to things that affect people in aging. So let's see. So finding a nursing home facility, they could help with that. Finding home delivered meals, they could help with that. Finding access to social services like heating assistance, like food assistance, for example. That's what they're set up to do. That's what they're set up to do. And
house at all, or
what's that?
painting a house?
Sure, that might, yeah, if there's a service that's designed to help seniors with home chores, they would likely know about it, and that would be the plan. So and it's all, like I guess I've said it a few times, but it's run by the state, so it's not like they're trying to sell certain products or services. It's all just a public service. That's what they're trying to do. Yeah. Let's see. We'll come back to that. One tip I thought was pretty smart was, as you're forming that team of caregivers, figuring out who's going to be the one responsible for communications, I thought was a nice tip. It's not the first thing that comes to mind, but just like any business or any activity that you're doing, there's usually a pretty high priority placed on communication. So what if there was one member of the team who was responsible for sharing the updates, for keeping a calendar, for example, and communicating that across the family? That could be a role for an individual to take on. Yeah. Often older adults, seniors, have lived their whole life and they've been working and raising their family, and they never needed public assistance before, and so they never used it. Perhaps as they age and the retirement money starts to run out, or the health care costs get really high, maybe they will start to qualify for public assistance. And there's a lot of different programs available. Some common ones that seniors don't know about is the SNAP program, Supplemental Nutrition Assistance Program. So it used to be called food stamps. But there's a surprisingly, relatively high threshold of income that one can have and still qualify for food assistance. And it's such an important issue for seniors and the elderly because they're very sensitive to nutrition, right? If a person doesn't have good nutrition, they're going to be more likely to be ill and not have as good as quality of life. So think of your parents, and there's a stigma against taking public assistance, right? Especially among the traditionalist generation, and that's okay. There's not a stigma against clipping coupons. So we try to talk about food assistance as though it's not designed to pay for all of your food. You paid your taxes your whole life and you supported other people. Now you need some help, and maybe this is a good idea. Instead of eating lower quality food, you can get some fresh food, save up for the holidays, that sort of thing. So only about 50% of seniors in Minnesota who are eligible for food stamps or SNAP are taking advantage of it. So 50% of the people 62 plus out there are missing out on that benefit and probably not eating as well as they should. It's about, I want to say it's about, I'm not going to quote it. I have the information and I'll follow up with you about it. Yeah, I'm not going to quote it. Yeah. Heating assistance is another. Anyone here, like, are you in this situation where the people you're caring for are running out of money and might qualify? Yeah, yeah. Heating assistance is another one where, you know, they get a discount on the heating bill. And what we hear, even from the Excel workers who go out and do home visits, is they find seniors especially, they'll shut off the power to most of the house and they kind of just live in one room because it's so expensive. And this morning, the woman was saying, well, yeah, that's what my mom does and she's comfortable with it because she doesn't use the whole house. Well, okay, if they're comfortable with it, that's okay, but if you're doing that because you don't feel like you have different options, it might be a good thing to look into. And then Medicaid is another type of public assistance. So the way Medicaid works for regular health care is it's publicly funded. People who are low income can get publicly funded health care. When it comes to long-term care, the way it works, so if someone had to go in the nursing home, they didn't have any assets, or they have some assets, they have to spend down those assets first to a very low level, some $3,000 in the bank, something like that. They get to keep their house, they get to keep some of their assets, one car, for example, and then after the person passes away, the state and federal government will recuperate some of those expenses from the estate. And the reason it's set up that way is so, you know, say there's a married couple, one needs to go to the nursing home, one wants to stay at home in the home that they own. Well, you wouldn't want to have them have to sell the home to get the coverage, so while they're both still living, they get to keep it, and then when they both pass, the state will take some of the money from the estate. And there are strategies to use that families can preserve some of those assets and not have to pay back at the full level, and working with a professional like here at Summit Investment would be one way to get some advice with that. All right. Whose parents are on Facebook? No one here? Oh, okay. All the time on Facebook?
You can put on Facebook. I don't know if he's ever gone back.
Okay, he's out there. Yeah, yeah. Well, this is just an example of do we know the passwords for our loved ones' accounts? Yeah. Yeah. Do we know all the passwords? I can hardly keep track of my own passwords, right? So so maybe it's some online investment accounts. Maybe it's some bills they pay online, or you might help them set up to pay online. Who's got all those passwords? Let alone the social media accounts. But something to think about in 2014. Okay, there's a good section in the booklet that's a glossary of different terms for caregivers, such as a geriatric care manager. Who's ever heard of a geriatric care manager? Yeah. So you've worked with one, Maria? No. No. Sure. In the medical profession, you know what that is. Yeah. Yeah, so who knew? I mean, there are professionals out there whose job it is to work with caregivers and work with folks to make sure that their care is coordinated as can be. So the purpose of, I think, having this language and understanding the terms is so that when you're working with the social worker, when you're working with the nurse, that you can make sure you're advocating for your loved one and getting the best service that you can. Home health care workers, for example. Yeah, there's a program where Medicare can be used to pay for home health services. And it's a good thing because increasingly more and more people want to stay at home rather than go in the nursing home. And plus, it costs about a third. You could take care of 3 people at home for what it costs to keep 1 in the nursing home. So it's just more cost effective to keep people in their own home. And there are ways to have insurance pay for those. So AARP we run a directory. It's nationwide, but it includes local resources. So at that aarp.org/caregiving is where a person could just type in your zip code basically and the type of service that you're looking for, and it has a list. So I don't believe I talked about Medicare yet and how it does not pay for long-term care insurance, or not long-term care. Did I mention that yet? Okay. So there's a misconception among a lot of people that Medicare would pay for the cost of staying in a nursing home, but it does not. And so there are long-term care insurance products that happen to be expensive. If you're already 55, 60 plus, it's very expensive to buy a long-term care insurance policy because the odds would say you won't be paying in for very long before you need to use it. So you have to pay a lot more each month. For a person who purchases long-term care insurance when they're 30 or 40, they would pay much less each month over a longer period of time before they'd likely need to use it. So it's more the thing that a retiree, we would hope, would talk to their own kids about, the importance of getting long-term care insurance when you're young. And we can talk about that whole observation stay thing when it comes to Medicare too. So the new healthcare law, in order to improve the quality of healthcare people are receiving, places some penalties or removes the incentive, maybe, for readmissions for people being discharged from the hospital and then needing to come back for the same issue. It's supposed to be set up so that you go to the hospital once, they fix your health need, and then you go home and you don't need to come back in order to get the same thing fixed. So if there's a readmission for the same issue, the hospital gets reimbursed at a lower rate for the procedures that they perform, for the services that they provide. Did I explain that well enough? So some hospitals, for example, are assigning a home health worker or a nurse to do a follow-up visit with the discharged patient, right, to make sure they know how to use their medication. Maybe they went home with an oxygen tank and they need to make sure they know how to use it, just to make sure that they're doing a home visit, to make sure that they don't have to come back, get treatment, and the hospital doesn't get paid for it the same way. Well, what is happening in some places is that when that person comes back to the hospital for the same issue, the hospital they don't admit them. They don't officially admit them into the hospital. They still come, they still lay in a bed, they still see the doctor, but they're only under observation. And Medicare doesn't pay for observation. So then they get a bill for thousands of dollars and Medicare won't pay it and the consumer is responsible for it. So for yourselves, for your loved ones, for your friends that you talk to, just Medicare observation stay. If you go in for an appointment, if you think you're being admitted to the hospital, make sure you ask, am I being admitted, or is this an observation stay? And AARP is working on some legal avenues to try to fix this problem too. So
in a red hot moment,
mm-hmm.
just under observation, can you advocate and succeed in gaining admission?
Yeah. Yep. So the question was, can you advocate and succeed in gaining admission so that it would be covered? That's one tactic to use. And another one would be to call the insurance policy and figure out what's going to be covered and then decide what you want to have covered. Does that make sense? Well, so, say you have to go back to the hospital, you find out it's going to cost you $10,000, then you just have to make a decision. Am I going to stay in observation stay, or am I just going to go home? And like I said, we're working on a fix for it in the long term.
guess what I still don't know is how successful is that advocacy to
Mm-hmm.
be admitted?
I don't know the percentage of people who try to become admitted rather than be seen in observation, but I have heard success stories where they pointed it out, you know, and I think it would be an important conversation to have. Are you trying to cost me $10,000 right now by not admitting me to the hospital? Do you realize that Medicare, in fact, I know you realize Medicare doesn't cover this. I can't believe you just tried to fool me into a $10,000 bill. Yeah. And this is kind of the fluffy section, nevertheless important, that taking time to care for oneself while caring for a family. I think you could say the same for parenting kids, right? You can be your best parenting kids or taking care of your family when there's time for yourself as well. And the distance being in, maybe in a different state, maybe just far away from a family can compound the issues and the stress that comes along with caregiving. The demands of work, and like Jim said, we're working on caregiver discrimination in Minnesota as a matter of state law, trying to create a protected class for family caregivers so that they can't be discriminated against. I mean, right now an employer could say, well, you look like an older worker. How much time a week do you spend taking care of your parents? Do you expect your parents are going to have a health crisis soon, and is that going to take you away from work? Well, we don't think that's a very fair system, especially as the baby boomers are aging, and not to mention how our culture has changed, and obviously there are women in the workforce, not just women at home waiting to take care of the family, right? So these people need to keep their jobs. And we've seen it. We ran a series of focus groups this summer with real caregivers who were going through these situations, and many of them had to leave their jobs. Maybe mom had a stroke or dad had a heart attack, and maybe they tried to keep their job, or maybe they just said, my mom needs me more than I can do while still working, so they voluntarily left their job. Another woman was subject to discrimination because it was okay for someone to leave work to take care of their kids, but when she needed to do it for her dad, they said, well, why doesn't your mom just do that? Why don't you just put him in a nursing home? That sort of thing. So unfair. And it affects women just because of the way our gender roles work. It tends to affect women more than men because they tend to be the ones doing the bulk of the caregiving work. And then that leads to fewer Social Security credits over time, so lower Social Security payments. And guess who's living longer and needing that retirement to last longer? So our system's kind of broken here. System is broken. So we're working on that. We're working to only 40% of Minnesota workers do not have any sick time at work. So if they need to bring someone to a doctor's appointment or whatever it might be, they're choosing between losing their job or caring for their family. And if they just had a little bit of sick time, studies show where this has been implemented, it's not like everyone's taking vacation all the time. They're using the sick time to take care of themselves and take care of their family. And who are these workers that don't have sick time? It's the people working over at Subway sandwiches or Pizza Hut making our food. And do we really want sick people in those type of jobs without the chance to take some leave? So we're working on that too. So, and another issue that we're working on that I'll just highlight here is a Minnesota Secure Choice Plan. It would be a public state-run retirement savings program, because a similar number, 40% of Minnesota workers don't have access to a 401k or a workplace-sponsored savings program. And if you're a small business owner, it's very expensive to try to set that up for your employees and pay fees for that. So the state could do it for relatively little money because they're already running pensions and retirement accounts for state workers. So that's another I would just highlight. And we have some time, so I could cover the cuts to elderly waiver. There were scheduled cuts. Elderly waiver is the way that Medicare dollars can be used to pay for home health care services. It's the program. That's what it's called. It's like the state has a waiver in order to make those payments for us. And there were scheduled cuts. The governor delayed them 1 year, but still the legislature needs to take action. Otherwise, some of the most frail and elderly people will have their health care cut. And then there's literally an issue of the law was amended recently to make sure it included language that would prevent us from literally throwing these people out on the streets without a different housing situation to go to from their nursing facility, because the nursing facility bills would stop being paid. So it's a very serious problem. There's also a push for deregulation of phone utilities. And what we know is, well, what we don't know is that the phone companies would be obligated to maintain landline service. They might just choose to invest in their cell phone towers and say, well, you know, the landlines are too expensive and cell phones are the wave of the future. But we know plenty of people who could care less about using a cell phone and rely on their landline for safety and communication. Plus, when there's an emergency, like when the 35W bridge collapsed, everyone was trying to use their cell phones and no one could because the lines were jammed. I was just out at the Mall of America on a Saturday, the last place I should have been. I couldn't even use my cell phone at the mall because there were so many people trying to use the signal. So we think it's not quite time to get away from landlines yet. And we can certainly talk more about your experiences, or if you have other questions. I'm sure there were some that didn't come out just while I was talking.